where this is going. I think we might be getting this conversation very wrong. I'm especially bothered by how quickly, sometimes scornfully, those questioning our vaccine protocols are dismissed as zealous flakes who don't know what they're talking about and deny clear science. I don't doubt that you've meant flaky people. I even hear legislators have been stalked or flamed online by a few people. But I'm very clear that doesn't describe everyone who speaks out against mandatory vaccines. Some of them, including physicians, scientists, and parents of vaccine-injured children, are anything but ignorant. They've researched these topics with care and intellectual honesty, and most of them are not what's been called anti-vaxxers. They do vaccinate their children for some diseases. Here are 5 questions they're asking that, in my view, deserve better answers than they've received. I'll submit those for the written record. Skip to 5. Take my word for it. They're very good questions. In 1986, Congress passed the National Childhood Vaccine Injury Act to shield corporations manufacturing vaccines from liability for the effects of their products. That's probably the biggest reason for the explosion of the recommended vaccination list from 5 entries in the 60s to 24 in the 80s to over 70 today. If your child is injured by a vaccine, you can't sue the pharmaceutical corporation that manufactured it. That has my constituents saying, let me get this straight. You want to ban my children from school if I don't inject them with substances that deeply concern me, telling me my fears are baseless because we know this is safe medicine, and by the way, the corporations that make and profit from them won't legally stand behind them if something happens. The principle these folks ask me to stand by is no mandates for liability protected products, and I wonder if that's an unreasonable stand. We are on the brink of banning from public schools children who do not get vaccinated for what could be a growing list of substances, regardless of the judgment of their parents and healthcare providers. My final question on behalf of my constituents is, can we move forward, or rather, are you confident that we don't have less sweeping and authoritarian options for dealing with situations like the multiple case of measles in the metro area? I thank you for the time to represent the views briefly of my constituents, for your hard work on this difficult issue.